Dr. Suzy Green, welcome to the podcast.
Thank you so much, Paul. It's great to be here.
Great to have you on. I think the last time I saw you, we were just both about to speak at the Happiness Conference.
That's right. Yeah, absolutely. I missed it the end of last year, but I think, the time before was when we connected.
I reckon that was it. Now, you have got a ridiculously long list of experiences. You run the Positivity Institute. You're an honorary visiting professor at University of East London. You're an honorary fellow at University of Melbourne. You're an affiliate of Wellbeing Institute, University of Cambridge. You're involved with the Positive Education Advisory Group. You're involved with the Black Dog. It's just ridiculous.
I've been showing my age. I've been doing this a long time, Paul. So, since about 2000. So, I've been doing it for a while and absolutely love what I do. Completely feel it's a privilege, and I also feel it's a calling. Feel like it's what I'm meant to be doing. So
it's clearly a calling whenever you see somebody like you spreading so far and wide and getting your message out there, and then training coaches as well as being involved in kids education. And look, I want to start with just a bit of an overview of positive psychology, and if you can, for the listeners, for those who are maybe not familiar with it, just the delineation between mental health as we talk about it today and positive psychology. My view is we don't have a healthcare system. We have a sick care system. And I think that's also very true for mental health. So can you give us an overview, just that distinction, and then maybe a dive into what positive psychology is all about?
Yeah, absolutely. And I think, coming from a clinical background, so I started off training as a clinical psychologist, which I'm still a registered clinical psych. And I'm really thankful for that training too, because it put me in a really good place to look at the full spectrum of mental health and wellbeing. Although I used to sort of laugh when I was doing my training, because at the time there was an Institute for Mental Health at the university that I was at, but it was mental ill health, it was really mental illness. But I think the term was used because of the stigma around mental ill health. So for many years, we've talked about mental health. And even now, I still hear people say, they have mental health issues, rather than saying, it's a form of mental illness or mental ill health, if you like.
Yes.
So I think, there's still a lot of focus when we talk about mental health on mental ill health, whereas, and there's definitely a place for that, and there needs to continue to be. But what positive psychology has really brought, and for me, it was so influential because, as I said, starting in a clinical realm, I worked out really quickly that we're just, chasing our tail, like we're just treating. We can't continue to just treat. And that there were these skills that you could learn. And often we'd use clinically to help people to prevent, episodes of depression or anxiety in the future. So, techniques out of cognitive behavioral therapy, for example, that they weren't just for treatment, that why weren't we taking these to kids in schools, or why weren't we taking them into the workplace? And so that's where I became really passionate, was in that proactive space. And that's where I've spent most of my career, really.
Yeah. And I have noticed that seems to be, I don't know whether this is true or it's just my noticing it, that there are an increasing number of psychologists calling themselves coaches and focusing on the coaching. Have you noticed that as well? And why do you think that might be?
I've been pretty verbal about that, because my doctorate was on the use of life coaching, evidence-based life coaching as a mental health prevention intervention. So that was in 2001. In those days, all of my buddies were, studying depression and schizophrenia, and I'm doing a life coaching study. And but it's really changed a lot over time. So I was really trying to encourage a lot of psychologists to move into coaching, but they were all like, and because I think coaching, hasn't had a rigorous, association, and anyone to this day can still call themselves a coach or a life coach. But I think that's why psychologists had tried to sort of, distance themselves. But I think they're now realizing that they should be in that space. Like we've got, as mental health professionals, we have definitely got a voice, and it's not to say that you have to be a psychologist to coach. I'm certainly not of that opinion. I want to put that out there. But if you go to be in coaching, then definitely need to do some education and training around mental ill health, how to recognize it, how to refer on. But as I said, I think psychologists have got a really important voice in the field of coaching, and particularly now as we're having lots of these discussions in my I guess circles at the moment around the impact of AI and bots on coaching, and what will be the role of the coach into the future. So it's really interesting times. But yes, I'm definitely seeing psychologists being more open to calling themselves coach. And the other piece of good news is I'm a coaching psychologist. Now, here in Australia, there are restricted usages of terms such as psychologist. You can't call yourself a psychologist unless you have registration with APRA. And we have colleges. So we have, for example, a sports psych college, a clin psych college. I'm a member of the clin college because of my background and ongoing commitment to that area. Coaching psychologist, as far as I'm aware, we don't have a college here in Australia. It's not particularly a well-utilised name. I don't believe it's, psychologist, as I said, is restricted, but not coaching psychologist. But in the UK, this is very exciting news. In the last 12 to 18 months, they now have I think they call them colleges, I'm trying to think, a college of coaching psychology. So there's a division. So with the British Psychological Society now have a division of coaching psychology, which is a huge step forward in this field. So that's exciting to see that it's really gaining credibility, and that, that there will be identified, chartered coaching psychologists in the UK now.
That is pretty cool, actually, because I'm a member because of my PhD of the sport psychology in it, and I'm an overall member of APS. But and I noticed that there was nothing around coaching, and I thought, well, I wonder why that is. And actually, you'll probably be familiar with Professor Joseph Chirochi.
Yes, Joe was one of my supervisors in my doctorate many moons ago.
Wow, that's interesting. Yeah, because I had a long chat. We've done a bit of stuff together, and so Joseph likes to call himself a coach now, and because he is very much into that positive psychology and process-based therapies.
That's right.
And actually saying, well, we should be democratizing some of these processes. Why the psychologists think that they own all of these things when they actually work and anybody can use them.
Yeah, I think you've absolutely got a point there, because if we look at the state of mental ill health, globally, we can't just leave it to completely to psychologists or other mental health professionals. But on the flip side, as I said, I'd love to see, and I am seeing coaches being more open to looking at the rigor, the underpinning rigor of not just coaching psychology as a dedicated field, which it is, but of the broader field of, psychology and other, I guess, psychoanalytic theories and techniques. So there's a whole range of rigor that can inform coaches' practice. And as I said, I think as AI comes to the fore, if coaches, they can't just do what bots do, like they're going to need to really develop do their own work and their own development. And then they're going to be working with people at more of those deeper levels, rather than that superficial, grow coaching. What are you doing this week? What's in the gap between here and there? I think, bots are going to move into that space a lot quicker.
Well, interesting you should say that. I was listening to a podcast, I think it was on the Health Report with Norman Swan at the weekend. And it was an American professor. I can't remember where it was, but basically they did a study where they brought AI into the first line in terms of diagnosis and some advice around stuff with people Googling stuff, and they did AI compared to doctors, and they found that the AI gave consistently better advice and higher levels of empathy.
That's not too surprising. My son-in-law is a doctor, but look, clearly, particularly historically, doctors were, got into medicine because of their, IQs, basically, not so much their EI or the bedside manners. Yeah. No, that does not surprise me at all.
And interesting. I mean, the just the way things converge. I had a sort of minor procedure. I was in the hospital and was talking to the anesthetist, and he said that he has a sideline where he works with a psychologist where they're teaching emotional intelligence to doctors and surgeons, because he said generally, to paraphrase him, they're shithouse at it, and he said part of it is just because you're exposed to so much stuff for so long that people, they kind of back off a little bit in terms of emotionally. I think it's maybe a bit of a coping strategy for people who've been in that phase. I sort of remember when I was doing helicopter search and rescue years and years ago, there does become a bit of a numbing over time, right? And I think there's a bit of a self-protection mechanism that develops.
Yeah, my partner's ex-military as well, and I think there's certainly certain types of personality and the ability to be able to do that work. Like I'm high on emotional sensitivity, which is actually, it's a good thing. And I've learned, I guess that you'd be familiar with some of the mental toughness toughness techniques. So, and look, to be honest, I'm probably historically been more mentally sensitive. Have a family history of anxiety, but I've learned through my psychological training to develop some of those skills, like attentional control skills. So I've learned some of those skills over time. But I think there's a few different reasons around the emotional sensitivity and emotional management too. But of course, we know that you can learn them. Not always easy, as we like to say, but it's possible to improve that emotional regulation or emotional management.
And it's interesting you talk about the mental sensitivity, because some people go, well, and the mental toughness guys, when I interviewed them, were pains to point out that it's not that mentally tough is good and mentally sensitive is bad.
No, that's right.
They can be advantageous in different environments. But I'm thinking, particularly as a clinical psychologist, being high in emotional sensitivity, I mean, that'd be tough, right? Because you have such a connection with the clients, and you're dealing with people who are having problems all day long, right? And it's got to take a toll.
Yeah, look, and again, in my doctorate, in our third year of the professional doctorate, we did like quite severe psychiatric disorders and illnesses. And the first, I think, lecture or introduction we had to that year was about, self-care and looking after yourself to be able to do that sort of work. So, I mean, I started as a psychologist in my 20s, and I'm actually really pedantic. I've been really pedantic about my self-care. And that was sort of supported by becoming a parent, which I realized too, that if I didn't look after myself, I wasn't going to be my best self as a parent. But I absolutely knew that I couldn't show up and do that sort of work, particularly the clinical work, unless I really looked after myself. But I think it wasn't something I don't know what it is, but I didn't have to work too hard. I was pretty good at that attentional control, being able to, have that session, be completely present in the session with the client. And then if I had to, have supervision, which we often do, or had to debrief, I would do that. But I was pretty good at that parking and then coming back to it later on if I needed to. Whereas I think some people really struggle with that attentional control and parking it. It's not like you don't come back to it, but you clearly need to get on with your day sometimes too, don't you? So learning some of those, I mean, mindfulness is one of those strategies, but there's a whole range of other strategies you can learn to improve your attentional focus.
Let's just stay on attentional focus, and then we'll go big again, right? Because we're in a rabbit hole, but I'm very happy to jump in and out of rabbit holes. Interesting. So attentional control, extremely important in that mental health, and particularly, as you said, as a clinician as well as an individual. I was involved in a Delphi study recently around high performance cognition, right? So looking at the other end. So this is with the Department of Science Technology group. It's all about military stuff and peak performance. And I was part of a Delphi study where they had a bunch of psychologists, they had military people, they had business people, they had researchers. Yes. And what consistently came out at number one in terms of performance psychology was attentional control.
Yeah, not surprising at all.
So talk to people a little bit about attentional control. Like, what is it? Why is it so important?
Yeah.
And maybe one or two little techniques that people can have to improve attentional control, to improve their overall mental well-being or performance.
Yeah, absolutely. I guess it really is being able to direct your attention where you're choosing to place it. Now, I mentioned mindfulness before, and that's a big conversation, and there are many definitions around mindfulness. And as you know, and some of your listeners will know, in mindfulness, they often talk about spotlight and floodlight. So I know when I did my mindfulness training a number of years ago, and it was actually fantastic. He had lived as a Buddhist monk and was a registered psychologist. And he explained that, sometimes you need to have that spotlight, so completely focused in on one thing or one person or one word or whatever your breath. But then mindfulness can also encompass floodlight, where so if I'm presenting, I'm trying to be mindfully aware of the broader context and situation that I'm in, rather than perhaps sitting in a one-on-one with a client where I'm spotlight, in on them. So I do think mindfulness, and it's often why you hear, and I think it was Professor Felicia Huppert that first said this, that mindfulness is the foundation of flourishing. So if you don't have a level of awareness, even if we use the term awareness, you're not going to be aware you're not going to be aware of the thoughts that are populating your head. You're not going to be mindful of seeing strengths in other people or thinking about using a strength. So I think mindfulness, for me, in its various forms and various ways that you can improve your ability to maintain mindfulness, is going to be foundational for attentional control. But some of the other techniques that we teach in mental toughness training are like number grids. So, getting just people to place their attention following numbers. We do, stalk stand, yoga poses, those sorts of poses, just being able to focus, being able to throw a screwed up piece of paper into a bin. Like, there's a whole range of these different activities where you're trying to block out noise and just focus in on what's happening in the moment, or where your target of attention is. So, there's a whole range of activities, but I would definitely say, for me, mindfulness training, just that simple. It's not simple, sounds simple. It's actually very hard, as you know, whether you're focusing in on a mantra or your breath, and that when the mind wanders, you notice it wanders, you bring it back. For me, it's been like, just going to the gym and lifting weights. It's the same thing. You're building up your attentional muscle. And I do think, and I know you're doing a PhD in I think, is it neuroscience or applied?
Well, it's actually applied psychology, but it's around resilience and stress fitness is the area of it.
Yeah, so so as you know, just building up those neural pathways every time you do it. But and also, I had a neuroscientist say to me once that as we age, there is just the maturation of the brain, and so yes, we learn through experiences that things aren't often as bad as what we think. So we tend to have less catastrophization as we get older. But so I think for me, over time, that capacity is definitely increased, in as much as being able to be aware of those ants. We call them the ants. Kids love that, the automatic negative thoughts. And rather than being completely consumed with them, being able to be mindfully aware of them and think, here we go again, Suzy. And because it's not as if, I've been working on some of these ants since my 20s, Paul, and sometimes there still trigger situations where an ant will populate my head and I'll go, really? Do I still have to go through?
Still there. You're still there.
Yeah, and that's where some of the ACT, which Joseph Shirocci is very familiar with, acceptance commitment training, can be really helpful, because you get that cognitive defusing, they call it, where you can just be a mindful observer of what's going on without it completely consuming you. And that's why even in CBT, cognitive behavioral training, when I did that very early on in my training, one of the strategies was actually write them down, because write the ants down, because when you write them down, you can look at them. And I think that helps with that distancing. And you think, that's crazy. But when it's just in your head, like, you believe it to be true. So it's hard to get that, whereas for me, particularly if it's something that I might be, waking up in the night, maybe a bit of rumination about something that's happening in my life. If I get up because I can't sleep, I'll write things down. And just that process of getting it out helps me to think I've parked it. and sort of tricks my brain into thinking, Suzy's parked it, she'll
It's
deal with it in the morning. Yeah, and then I can go to sleep. So I think some of those strategies have definitely helped with my attentional control capacity also.
Yeah, look, a quick little story just on that last thing that you talked about, and then let's go back to the attentional control. I often talk about a dump pad for people who are worriers and who wake up in the middle of the night. Just have a dump pad beside your bed and write down all the shit that you're worried about or that's in your head just before you go to sleep. And there was this lady I remember we did. It was in Tasmania, one of the two on City Council. And she emailed me, she had all sorts of problems, physical, mental. And she said, she emailed me about 8 weeks later and said, that dump pad has completely changed my life.
Yeah.
Because she said, what it enabled me to do was to understand that, okay, it's written down, I can deal with it tomorrow. She said, then my sleep improved. And because my sleep improved, my energy improved. I then had time and energy to exercise. I made better choices around nutrition, and it all came back to that attention and control of that, or that self-distancing or cognitive diffusion, which we can come back on. But I wanted to just get a little bit higher and talk about that spotlight and floodlight that you talked about in terms of attention. That is training that they do for elite athletes and the military as well, right? Yes. As well as normal people. Because if you think about, particularly if you're a team sport player, whether it's a soccer player or a rugby player, you've got to have that ability to quickly go into spotlight focus when the ball is coming at you so that you can control it. And then very, very quickly go to floodlight focus where you're taking in the entire pitch. And even thinking in soccer, that when you're about to receive a pass, you quickly scan. So you go from spotlight to floodlight, back to spotlight, then to floodlight. And they do lots of training with elite athletes on just being able to shift that focus really quickly. And you can imagine how that's going to apply to the battlefield as well. So this attentional control is so important. And my wife, who's done quite a lot of ACT courses, has done stuff with Joseph, but also has done Japanese psychology. And in Japanese psychology, they say that the most important thing that you have control of in your life is the flashlight of your attention, right? And I really like that idea that it's a flashlight, so you're in control and you can choose where it's focused. But I think it also, the spotlight and floodlight, there's also internal and external in terms of attention, isn't there?
Yeah, and I like that. Yeah.
We get in trouble a lot with mental health because there's too much internal focus on the spotlight, right?
That's true.
Internal attention. That's where all the shit happens, right? It's in our heads.
Exactly, yeah. And the other thing I was just thinking about is because in positive psychology, which I didn't define, I think earlier on you asked me to
we'll go back to that one.
And look, there's many definitions. My favorite one is the science of optimal human functioning. So it's rather than, I guess, clinically, we've been focusing on dysfunction. Positive psychology is around optimal human functioning. And so, who isn't really, not interested in that? Most of us are interested in being our best selves. But one of the big areas of research in positive psychology has been on the study of positive emotions, because historically, again, was all, particularly since World War II, and understandably there needed to be a greater understanding of the so-called negative emotions. And I still struggle with the labels, but just for the to help us communicate here. And we know that when you're particularly in that fight, flight, freeze state, particularly fear and anger, our thinking and our visual perception narrows. And the research that particularly Barbara Fredrickson and colleagues have done is when you induce people into a positive emotional state, thinking broadens, and they use eye tracking studies in research at, again, inducing people into a positive mood state through music or through weather. There's various ways you can do that. And people in the positive mood state are more likely to see more in the floodlight. So I guess, maybe a question for you too is, if you're particularly in a military setting, I'm thinking, and there's potentially a high level of, monitoring what's happening, and there could be a level of fear, although I understand also military are trained to manage that. to be able to keep that floodlight when our whole physiology is honing us in on a focus, that must be a real skill to develop that balance between.
That is, and there's lots of training around the ability to deal with that, right? And to deal with that amygdala hijack. From a neuroscience perspective, your amygdala hijacks your brain, and of your focus becomes both temporarily, it shortens, so you're just about the here and now, and it very much narrows, right? And it's a real survival mechanism. But spending too much time in there is not good for anybody, right? And particularly in high performance moments, is that you got to be able to shift out of that really, really quickly.
But you know what, Paul, when I first came across mental toughness, which was Professor Peter Clough in the UK presenting, it was 2012. I was at an educational conference in Kansas in the US, and I thought, I'll go along, this will be interesting. Hadn't heard of the construct before, and he's a sports psychologist. So he was talking about, the development of the construct and how he used it in sports psych. And I'm sitting there as a clinical psych going, I use these same techniques clinically. So I use visualization techniques we use for the treatment of anxiety, phobias. We use imaginal desensitization, visualization. We use anxiety, breathing techniques for reduction of anxiety. So the strategies that Peter was using in a performance context, I was using in a clinical context. And then that was my epiphany, like, well, okay, if you're lucky enough to have been an elite athlete or, had a great sports coach, and I use this, tongue in cheek, like lucky enough to have had mental ill health and you've been to see a psychologist and learned some of these skills. But the majority of people in the bell curve have never had access to these skills, which is hence why I've been so focused on positive psych, because it has been primarily pitched as a preventative and promotion, mental ill health prevention, mental health and wellbeing promotion. And so it's about taking those skills that we know works in elite athletes settings or clinically, and let's take them out because we can use them in everyday life for the challenges that we face.
Absolutely. And I tell you, they're not only used in elite sport, they're also used in elite levels of the military, right?
Yes,
so
that's right.
The four components of mental toughness are exactly the same. There's slightly different wording of what the US Special Forces, they're called the Big Four.
Right.
Goal setting, self-talk, mental rehearsal or visualization, and arousal control.
Absolutely.
So they apply to elite levels of military, elite levels of sport, and to optimal human functioning. As well as avoiding or managing mental ill health conditions as well. So
it's a triple whammy, I call it, because yes, as you said, reduction of mental ill health, promotion of psychological well-being, and capability building, just to help us perform and to be our best selves and to grow. So it really, you get a triple whammy with using these techniques.
Yeah, absolutely. Let's talk about positive education, because you're heavily involved in the positive education movement. You'll do a much better job of explaining it than I will. So can you just explain, first of all, what it is for people at a high level, and what your involvement and experience has been with that positive education movement?
Yeah, look, again, there's been various definitions. I've been involved in some of those definitions. I think it's like, any field, there's an evolution of the understanding of what it is. There's been a little bit of criticism just about even using the term positive, same with positive psychology, and discussions around, in time, will we drop the term positive because psychology will be transformed and it'll be balanced out. It won't be so deficit focused. Will education be transformed? Because many people that have worked in education will say that similarly it has been quite deficit focused, what we're not doing well rather than what we are doing well. But when Seligman first moved into the field and came to Geelong Grammar 2008, 2009, it really was to bring, I guess, the science of positive psychology. So what do we know about optimal human functioning, about boosting mental health and well-being, and then how do we apply that in an educational context? So we've come a long way, and I've really had the good fortune of being involved from the beginning here in Australia. It has been primarily the independent schools that have had capacity to bring in independent external consultants like myself. But we're certainly seeing Department of Education jumping on to concepts like mindset, growth mindset. I think, that's made its way into a lot of public education now. But I have a model of, my own model of wellbeing and flourishing, and mindset's just one of the M's. I've got 6 M's in there, 6 core psychological capabilities. So there's a whole lot more, including mindfulness, including understanding motivation. So again, there's a whole range of these, psychological concepts that help us really enhance our well-being. That the argument is why aren't they taught, not just like reading and arithmetic, but why don't we teach these skills of well-being? And the term that's being used and being researched through PhD research at Melbourne Uni at the moment is how do we create and enhance or increase wellbeing literacy for students, so students start to have a literacy around their wellbeing also. So there's still a way to go, and Australia's arguably, well, I would definitely say, still leading the world in the application. It will be. It's only a matter of time, I would say, until it's in all schools into the future, but we've still got a long way to go globally in that regard.
Yeah, absolutely. And look, just on the topic of well-being literacy,
yes.
I was having a conversation with my daughter over the weekend because she's in year 12. She's a prefect. She got elected as a prefect.
Fantastic.
And she went to the head and asked for a new role of prefect to be health and well-being prefect.
I love it.
Yeah, because so see, me and my wife are obviously in this game, and here is coming on. We have lots of conversations, and she is very concerned about the level of well-being knowledge with the kids, and she said, "Dad, why don't they teach this in schools?" So she decided she was going to do something about it. But very interestingly, she at the end of last year did a survey. Asked the teachers if she could do a survey of the years 9, 10, 11s, and 12s. And I helped her with some of the questions because she wanted data around their diet, around their physical activity, around their sleep habits and their screen. And the data that came back was absolutely shocking, right? Absolutely. And it's like, why don't we teach? So question for you, I mean, this is the big, why are we not teaching kids about the fundamentals about movement, nutrition? Like, probably part of the nutrition ones, there's so much arguments about what is a healthy diet anyway, but those basics about why it is important to move, nutrition, sleep, screen use as well, which is just ridiculous. And we think about that spotlight, floodlight attention. Jesus, is it spotlit for like 5, 6, 7 hours a day for a lot of these kids.
That's right.
In on a virtual world that's just crazy. So that question, and then why aren't psychologists trained in the importance of exercise? Maybe they are these days, but the importance of exercise, the importance of nutrition, the importance of sleep, rather than just talk about the head stuff, because anybody who says it's just you can solve that with just head stuff, in my view, is absolutely bonkers.
That's right. Yeah, no, we need it all. And you might be familiar with the PERMA model that Martin Seligman first published, which is a model of well-being, which stands for positive emotions, engagement, relationships, meaning, and accomplishment. And
then the H.
They've added an H or a V for vitality. So there's an increasing recognition, and I couldn't agree more. I mean, I personally realized that very early in my 20s and have stuck to a regular, health and fitness regime since my 20s, which has certainly had a significant impact on my mental health and well-being. So I think you're right. I think there's so much to learn within psychology because it is a broad and deep field, but I think we do need to have a greater focus on the holistic approach, but also on the flip side, for anyone that is in, allied health or has been focused physically, and I was thinking about that in preparation for today, because people are learning a lot particularly through social media, and people like Andrew Huberman, and there's some great people out there giving fantastic tips, like the importance of getting out and getting just being outdoors, getting sunlight, cold baths, all of these great physical tips. But you've probably heard yourself, Paul, people say, well, I thought I was looking after myself. I was eating well. I was exercising. Because we know on the flip side, if you don't address, and this is a lot of the emotional stuff, then it's going to come out somewhere. So we need both. We need that holistic approach to our health and well-being. Absolutely. But yeah, I guess it's hard within courses. How do we fit it all in? And even at school, that's the challenge. And PDHPE, personal development, health, whatever the subject is that, is in senior high school, it's there. I guess it depends on the teacher, the educator that you get and how passionate they are about it. But I would say, having done POSED for a number of years now, the earlier you can start, the better. And we've done some work with early childhood educators because the little kids, as you know, they're open to this stuff, and they're actually going home and teaching their parents about growth mindset or mindfulness and filling your bucket filling, you've probably heard. But when they get teens, it's like the eye rolling starts, So, and for a while, you've probably been through this. I know I did with my kids. I thought, did anything sink in like through their teens? And you think, I don't, it's so challenging. But then they come out and you think it actually did sink in.
Yeah, that's
so
right.
The earlier we can start, the better with young kids.
Yeah, and look, let's stay on the topic of kids, but I think it's a broader discussion as well.
Yes.
I mean, I think there's been a heap of benefits about the discussion around mental health that has now come into the workplace around psychological safety. Is there a risk, though, that there has been so much talk about this and so much that it's okay not to be okay, and particularly with teenagers, right, who are struggling for identity? I mean, everybody went through that. That's just brain development, that you were in the teenage years. You are wanting to nail down your identity.
Yes, that's right.
But there's, for me, I see a lot of people who are now labeling themselves, and they're talking about my anxiety or my depression.
Right.
And I've got a deep cellular vitriolic detest of labels and people who are just labeling themselves, and particularly at such a young age. What's your view on this stuff, and how do we balance this out?
Yeah, I think you're right. I think, great that we are destigmatizing and people can now talk about it. But I think you're so right. Look, I've put it out there. I'm not a child or adolescent psychologist. I've had my own kids that I've worked in schools, but we primarily work with the educators. But I think you're right. Part of it possibly is around identity, fitting in, and, if someone else has got anxiety, and it could just be the normal anxiety of working out who I am, And as, we know that there's specific criteria required to get a formal diagnosis of a clinical anxiety disorder or a clinical depressive episode. And if we think about it being that our emotions sit on a continuum, and so there's positives and negatives. But even if you think about the 4 primary emotions, so fear, we all want a certain amount of fear. That's what keeps us safe. But when it goes to a clinical extreme, it becomes a clinical anxiety disorder. Anger, like we need to be able to stand up for injustices and, be assertive, but we don't want it to become rage. So I think, again, a lot of this comes down to education and just being aware that it might be a normal emotional response to the situation that they're in, that they're dealing with, rather than I have a clinical anxiety disorder. Although in saying that, certainly go and see a mental health professional to, diagnose or help you allay your fears around that also. So, and as we know in ACT, acceptance and commitment therapy, a large part of ACT is being able to, again, that diffusing, inviting in the uncomfortable emotions or the uncomfortable thoughts. And they often use, like, you can draw little cartoons of, little Miss Stress, little Miss Stress. That's me a lot of the time. Little Miss Stress, she can come and take a seat on my bus. She can come along for the ride, but she's not driving my bus. I'm driving the bus.
That's the key, isn't it? Yes.
Exactly. Yeah. So,
And can you just dive deeper into that for people a little bit? Because I think that's a beautiful, I mean, I love actors. Carly's done a lot of acting. I've sort of learnt it off her, but that idea of taking stuff along with you and just explain that distancing or that cognitive diffusion of when that process of little anxious Suzy can have a seat on the bus. Like, what's happening in the brain there? Why is it useful to do that? And what are some things that people can think about?
Yeah, well, I think, I mean, it is a skill to learn, but particularly when you're younger, and I struggled, as I said, quite a bit with anxiety. I didn't even fully realize, probably, high functioning anxiety, didn't fully realize probably, until the last 5 to 10 years that I had that. It's what really drove me. But it can just completely consume you, like when you feel anxious, like to the point where you're ruminating, or you can't think about it, you haven't got that attentional control, and it takes over your mind, it takes over your body. And so some of these techniques where I guess it does help you to see that this is not who I am, it's not my identity, but I am experiencing symptoms or feelings of anxiety, and that's okay. Like, as a clinician, I would say to my clients, I'd be more concerned if you weren't feeling a little bit of fear in this situation, or you weren't feeling a little bit of anger. Like, that's really normal. But when I guess you start to increase your levels of self-awareness and you start to track, what's, I guess, provoking or triggering your anxiety, then you start to see that little figure, oh, yeah, she's been there for a while, or, little Miss Critical or whatever it is. And when you start to see those themes and those patterns, and then we can sort of give her a bit of a label that gets her, she's not completely, she doesn't consume me, she's just a part of me. But I also I'm a little Miss Optimistic as well, so I've got other parts of my identity that are strengths and capabilities, and they can coexist on that bus. I mean, that's why that movie Inside Out was so brilliant.
Isn't it? Yeah, I was just thinking about that. And it's like every single person in the world should watch that movie, but watch it through the lens of what you just said, right?
Yes.
Is that we all have these different emotions that pop up, and some are stronger than others. But from a Japanese psychology perspective, and the reason I love this is Greg Creech, Carly's mentor, says your life is not based so much on your life, it's based on what you pay attention to.
That's
and
true.
As it's somebody with neuroscience training, I love that, because whatever you pay attention to, your brain commits cells to it. So it's not so much that we have little Miss Anxiety or little Mr. Anxiety in mind. It's how much attention you're paying. Again, we're coming back to attentional control. The more attention you pay, the more it grows, right?
That's right. And the thing is, which is often the first response to uncomfortable emotions or thoughts, is to just, I don't want to think that, or I don't want to feel that. And this is why there has been such a strong movement to act, following on from cognitive behavioral therapy, which was very much about identify the unhelpful thought, in particular, challenge it and replace it. Because sometimes if you try and get rid of them, they're just like, hello, Paul, I'm still here. Like, right. They try to get your attention. So, and this is, people use that analogy of don't think about a pink elephant. So we know that the more you don't think about it, it actually gets stronger. So ACT is very much about acknowledge it, like it's there, it's okay. And that approach seems to dampen the response because you've given it your attention, and, give it your love as well. Like, thank you for, raising some awareness that there might be something to be aware of in this situation, and then again, you can take that seat, but you're not necessarily driving the bus on this occasion.
Yeah, and I love that distinction between CBT and ACT, where you're not trying to dispute it and replace it and stuff like that, where in ACT you're just acknowledging it, but not giving power to it. I think that's pretty key. You take it along with you. And the big question is this helping me right now? And if it's not helpful, you just stick it on the bus and you go and do it anyway, and you take it with you along the journey, right?
And I think the other part of ACT that really resonated with me was the values alignment. I mean, when I was telling someone yesterday, I did one of the first ACT training in Australia, in the 2000s, and I was already doing coaching then, and we use values at Sydney Uni, where I worked with Professor Anthony Grant. Values was a very important part of coaching. And so when I was learning about ACT, I thought, oh, wow, that's such a great alignment with what we're already doing in coaching. And as you know, like in ACT, a large part of what allows you or helps you to sit with the discomfort is knowing what matters most in your life, getting clarity on that, and then you're moving in that values congruent direction gives you, I guess, the courage in many ways to be able to sit with the discomfort, because this is what really is important to me.
Yeah, I think that values based. I mean, my listeners will be very familiar with it because Carly talks about it a lot, and I'm a big fan of identifying your values, right? So for me, for example, one of my key values is authenticity, and it's that value that is the driver for me exercising every day, for managing my alcohol, for eating healthily.
Absolutely.
Because in the absence of that value, I would certainly not be where I am and doing the things that I'm doing, right?
Yeah, absolutely. And I mean, authenticity is an interesting one because, yes, it is about, living in alignment with what your core values are. But of course, we're developing and growing as humans throughout our life course. So it doesn't mean, like, it can also tap into your best self. You might not be 100% there right now, but part of that authentic commitment is about how do I want to show up? Who is the person I want to be? I might not be. I mean, most of my coaching clients over the years haven't been fully living their values, and then as they start to, even just small tweaks, they start to feel better, psychologically, physically. It all seems to make a difference once you get clear on what matters most and make those small little shifts towards living that.
Yeah, and then when you start to get results, it builds self-efficacy, which then
absolutely
becomes self-fulfilling, right? And look, I think for me, the authenticity is an umbrella one because of what I do, right? Because I go and I'm talking about performance and well-being. So to be authentic, I have to be doing the stuff that I'm talking about, right? I can't be telling people about ice baths and cold showers if I never get in them. No, it's ridiculous.
Exactly. Well, that was part of my challenge, Paul, as I was saying to my partner's ex-military. And so I did the Tough Mudder about 10 years ago now. And, because, I'm out there talking about mental toughness, but I actually, bravery was not one of my strengths. So,
right.
I've been working at it. And I think hopefully I can be an example or a role model that, you don't have to be born with this. You might have a history of anxiety or whatever it is, but you can learn these skills and they can make a positive impact on your life.
I want to talk about something philosophically, just because I'm going tomorrow night to talk to a bunch of year 12s, and I'm talking to them about stuff that will help them to get through year 12 and the rest of their life. And I'm actually starting with the core principle that life is hard. Do not expect life to be easy, right? You are not entitled to happiness. You're not entitled to a good life, right? And because I think that all of this, particularly the social media and in the West, this whole happiness trap that we're in and this entitlement mentality then leads people to be victims and then focus negatively on it. And my point of view is if you are alive, you're so friggin' lucky because you have a 1 in 400 trillion chance of ever being alive, right?
Absolutely.
And if you're over the age of 27, as me and you are, right?
Yeah.
You have it better than 99% of the population of humans ever, right?
Yes.
And it's when for me, it's about those base principles and coming back to the Stoic philosophers, Epictetus saying that you should not enter into lightly that for which you've not prepared, and he was talking about life, right? So, how much of this is about just a resetting of people's expectations around what life should be like? Because I think we're just marketed and sold that life should be easy and we should have happiness and we shouldn't be offended by anybody. And it's just, that's great in the workplace, but it doesn't really interact with the real world very well. You will meet nasty people. The universe will serve you up a shit sandwich, right? It's like,
that's it. Yeah, that's life, as Frank Sinatra
yes,
sings so beautifully. And the Buddhists too say their first
yes, life is
principle
suffering.
is life is suffering. I do think when you're young and you think you're going to live forever, it is hard to get that bigger picture or that bigger context unless you've had some trauma or some challenges in your life as a young person. And I've met incredible young people that have, and they have such a different perspective on life to go through that. And I do see, having worked in schools and clinically with parents, the old helicopter parenting or cotton wool. And of course, there's a good intention behind that. I'm a parent. No one wants to see their child suffer or get hurt, but that is life. And the problem is, having worked with young adults that have been buffered or protected, they don't learn those skills.
Absolutely.
They haven't actually had an opportunity for character building, if you like. So it is hard as a parent, but it's actually better that if you let them struggle a little bit, don't try and solve all of their issues. But yeah, I don't know how we try and get kids to look a bit longer, a bit into the long term. I know when I was coaching senior high school students, which I did early on in my career, and they were all anxious, or the parents were anxious about the HSC, part of the coaching I do with them was firstly around values and getting a reflection on, and often their values have come from their parents. So it can be a time of reassessing or thinking about their values, but actually looking beyond the HSC, and in coaching, we call it the fuzzy vision. So it's not necessarily a specific, I'm going to be this, do this professional, live here or do this, but starting to look at, again, coming from a values base of what might a values congruent life look like for me. And it can take the pressure off the HSC because they can see that there are many different, this is hope theory for those that are familiar with Snyder and Lopez's work, multiple pathways. And we know that high hopers, and hope is highly correlated with well-being, that the more we can start to see that there are multiple pathways in life, and we're less hung up on one pathway. But I think if we can help young people, and maybe through technology and VR and augmented reality, we might be able to help them start to get a sense of, even though life is short, it really is short, they don't see that at that age. They just see that, I've got the whole of my life. So if we could sort of balance it, we might be making decisions based less just on the short term and maybe on the longer term is the key. But who knows? Tricky one.
And I don't think it's just kids as well. I think
no.
for adults too. And look, last question, because I know you've got to go, because you talked about hope. Yeah. I'm glad you brought that in. I remember listening to Dennis Charney, who's a neuropsychiatrist who interviewed many of the survivors of the Hanoi Hilton prison camp, which I talk a lot about. And I interviewed one of them, a guy called Lee Ellis. So these guys went, some of them did 7.5 years in this prison camp and suffered terrible torture. Some of them 3 years plus in solitary confinement. But what Dennis Charney found is that all of them, the ones who survived, their levels of hope were through the roof. Their hope and optimism for the future was through the roof. And he has shown other trauma victims and stuff like that, and people who survived Auschwitz, that when you get through hard stuff, it seems, you need enough hope to get through it in the first place. But when you do get through it, it seems to double down on both hope and optimism for the future. And so I just wanted your view as a clinical psychologist on, there's so much talk about post-traumatic stress disorder, and rightly so, because a lot of people do suffer from it, but so many people benefit from post-traumatic growth.
That's
and
right.
I just think there's nowhere near enough talk about that, and about character building activities and the benefits of doing hard shit.
That's right. I mean, as you know, PTG, post-traumatic growth, is an area that falls under the umbrella of positive psychology research. And I think it is, more people are talking about it. It's getting out there into the community now. I think at the time it's awful. I mean, I haven't had anything really traumatic in my life. I've been through a divorce, which wasn't pleasant by any means. And I've been through a business partnership breakdown, which was worse than my divorce,
Yes.
and they're all awful at the time. In my training as a psychologist, I got to sit in with an incredible woman. She's passed away now, who was my mentor for 2 weeks. She invited me. She said, Suzy, come and sit in and watch what I do as a psychologist. And it was down in the Illawarra. And she said to me, it's not going to be necessarily a little bit, it might be different from what your experience will be in Sydney. She said, but we get the full gamut of, people that turn up here, and you'll hear so many different stories. And I heard some pretty horrendous ones. And I also worked at the same time in a private psychiatric clinic, and I heard some horrendous stories there. So, but she always used to say to me, she'd say to her clients, like, it's absolutely awful, like when you're in the eye of the storm, but you will get through this. In most cases for people that don't have a life-threatening illness, but you will get through this, and you'll be able to look back and see those pearls or those gems. Yeah. And she always used to say, like, there's no science on this at this point anyway, but it'll be incredible the people that then come across your path, the people that you meet in your life that are going through something similar, and you'll be able to relate to them and support them as well, because you'll know what it's like to have been through that situation. So I always try and bear that in mind, as hard as it is when you're in the eye of the storm. And that's where, yes, it helps to have all of your own skills, but you really need the network and your social system and people around that can help you, because it's hard to use your own skills when you're in the eye of the storm. Yes. But yeah, I try and keep in mind now, like, it doesn't typically last forever. I am building character, and hopefully it's going to be, there'll be gold that comes out of this horrendous situation that I'm going through.
Yeah, and I think we need to broaden that out, not just from big T trauma down to little T trauma, or we need to coin a new phrase, post-discomfort growth.
Yeah, exactly. Exactly, that's right. Because and I think, as you'd know, in schools, that's been the hope and the aim with outdoor education programs, which
I love them.
I think they're brilliant. And if you can combine them with some of the pos-psych research, we did some work many years ago with Ballarat Grammar and the outdoor education group, we did pre and post mental toughness measures. And
nice.
Yeah, so and we trained the OEG, outdoor education group, facilitators in the science of mental toughness. So they knew all the physical stuff, but they hadn't, again, as you're saying, this disconnect, we need to get, more connected there. So, but, I'd also heard at some schools I was working at that parents, particularly of girls, were, making excuses as to why they couldn't go on camp.
Yes.
And it's crazy. It's crazy. I wish, again, it wouldn't have been pleasant, and I would have probably tried to get out of it if I could. But, in hindsight, you look back and you go, wow, it was hard, but look, anything you do that pushes yourself out of your comfort zone, as you and the listeners will know, might not be pleasant at the time, but at the end, how good do you feel that you've done it?
That's right. Absolutely. And I think best summed up by Stan Beecham, who was a psychologist on my podcast, and he said, do you want to be in your 90s on your deathbed looking back on life going, that was an easy life, or that was a life that I could be proud of?
Oh, I love that. I absolutely
That's pretty cool, isn't it?
That. Absolutely. Yep.
Suzy, you've been very generous with your time. I know you've got to go because you're very busy. Thank you very much for this. Now, you got a whole heap of resources, courses, all of these sorts of things. Where can people go if they want to just find out more about positive psychology, or if they want to do some coaching? What's the resources? Where do we send them?
Absolutely. Our website's the first point of call, thepositivityinstitute.com.au. We do have a lot of free resources, and we've just launched the Academy in the last 12 months. So we have a digital wellbeing and performance program based on my 6M model that I was telling you about before. Cool. I have my book, The Positivity Prescription, which is for the general public, and I've got a whole lot of texts for those coaches that are on here on positive psychology coaching. So I've co-edited 2 textbooks on, which is my specialty, bringing in the science of pos-psych into a coaching context. But all of it's on the website. And for those that are interested, I'm on LinkedIn. We do have a Facebook page and Instagram. We have a business page, and I have a private page, which is still open at the time being. And I try to walk the talk as much as I can on that Insta page, Paul.
Brilliant. Great stuff.
Yeah.
Dr. Suzy Green, this has been awesome. Thank you much for your time and your knowledge, and keep doing your important work. Let's just move the needle bit by bit.
Yeah, you too, Paul. Thank you so much.
Awesome.